Hello everyone, welcome back to my channel. This is Dr. Spinach. So in this video we are going to talk about normal entropy. We are going to talk about ECG and we are going to interpret the ECG, the waves that are shown in the ECG. And before doing that, I would first ask all of you to please subscribe to my channel because it helps me boost more confidence. Anyways, now let's start this video. So ECG is basically an electrocardiogram. Now electrocardiogram, it helps measure the electrical activity of the heart, and when this electrical activity of the heart is displayed in the form of a graph, then it is known as ECG. ECG is measured using 12 lead system. And please forgive me for the background noise of my pen. I tried to shut it down, but I just couldn't find it that in settings. Anyways, this 12 lead system has been explained in my previous video on ECG leads, so if you haven't watched that, you can go back and watch it. Okay, now you have to understand how is ECG recorded. And ECG is recorded on a millimeter square graph, as you can see here, a millimeter square graph at a speed of 25 millimeter per second. Now you might find this a little bit slow, so why don't you take the notes as well? So please take the notes along with me, it will be helpful for you. Now these 1 millimeter square square boxes are divided using these thin lines, you can see, and after you get 5 boxes on the vertical side, and 5 boxes on the horizontal side. These are divided by thick lines on all the sides. So this will be thick lines over here, thick lines here, thick lines here. So this is how your ECG is usually represented using the graph. Anyways, what's important for us is what is on the y-axis and what is on the x-axis. Now you must have seen the ECG something like this. Forgive me for my lines, they're not straight. So this is the horizontal axis or x-axis. On x-axis is represented time in seconds, and on y-axis is represented amplitude. That is how powerful these electrical signals are in terms of millivolt. So if the amplitude of the ECG is high, that means the electrical signals are high. If it is low, that means the electrical signals are low. So in atrial systole, the electrical signals will be more as compared to atrial diastole. Similarly, same way with ventricular systole and diastole. Now let's move forward with a drawing of the ECG. You're very much familiar with P wave. This one is QRS complex and a T wave. I'm sorry about the size. This is a T wave. So we have a P wave, QRS complex, and a T wave. Right? So before we dive into what is the cause of each of these, let's first go into the conducting system of the heart. So talking about it, in the conducting system, we have an AC node, which is then followed by AV node. AV node sends impulses to the bundle of hairs, and then bundle of hairs send these to the Purkinje fibers. I'm just going to write these down. So this is the conducting system of the heart. Now when atria contracts, the signals are sent from SA node to the atrial muscles. So when SA node sends signals to these atrial muscles contract and therefore leads to atrial depolarization or atrial systole. This atrial systole is actually represented in the form of P wave. I'll just write this down. So P wave represents atrial depolarization, the duration of which is about 0.1 seconds. That means this will be shown on the x-axis, and the amplitude is 0.5 millivolt. So if you see it here, this one will be amplitude, this one will be around 0.5 millivolt, and this one is duration, this will be around 0.1 seconds. Please do not go according to the boxes. These are not the right boxes for P wave. Now when you say 0.5 millivolt, did I mention before that 1 millimeter on the time axis, that means here, represents 0.04 seconds, and 1 millimeter on the y-axis represents 0.1 millivolt. That means when you say it's 0.5 millivolts, 0.5 millivolts will obviously mean around 5 small square boxes. And when you say it is 0.1 seconds, then 0.1 seconds will mean around 2.5 small square boxes. So basically what we see is the number of boxes if they are increased or decreased. So in complete ECG, you have to see a P wave, a Q wave, a QRS complex, and a T wave. Now, if the size of the QRS complex is increased, amplitude is increased or decreased, if P wave's amplitude and duration is increased or decreased, this will tell any abnormalities regarding bradycardia, supraventricular tachycardia, and rest of the other diseases of the conducting system of the heart. Anyways, let's go back to the QRS complex. Now, QRS complex denotes nothing but ventricular depolarization, which also means ventricular systole, the duration of which is around 0.08 to 0.1 seconds, which will be around, again, 2 to 2.5 square boxes, small square boxes, and amplitude will be around 1 to 1.5 millivolts. That will be just one. That will be around 10 to 15 small square boxes. So if I'm wrong, please calculate it, okay? Okay. Anyways, the next one is the T wave. Now, T wave represents nothing but ventricular repolarization. That means ventricle is now in diastolic position, and most of the time T wave is only seen as either elevation or inversion. So we don't need to learn the values of ventricular repolarization in terms of exams. Anyways, now there are some small but important markings that we need to remember in the ECG as well. These include PR interval. Now, what is PR interval? PR interval starts from the beginning of the P wave, that is from here, until the peak of the R wave, that is until here. So this one in yellow is PR interval. It's not visible. I'll use the other ink. So the PR interval tells us about the functioning of atria and AV node. So it tells us about atrial depolarization time along with the P wave, of course, and also tells us AV nodal delay. Now, in order to understand AV nodal delay, we need to understand the PR segment. Now, PR segment starts from the end of the P wave until the beginning of the R wave, so until here. So this is a PR segment. Now, when PR segment basically tells us what will come after the P wave. So P wave, that means, please look here, P wave means SA node fired, and when SA node fired, the impulses were sent to the atrial muscles, and then these impulses were then taken up by the AV node or were sent to the AV node through internodal pathway as well, and then these impulses from AV node will travel into the ventricles. Now, when these impulses travel into the ventricles, this time taken from for AV node to send the impulses from its original place to the ventricles is denoted by a PR segment. So this is AV nodal delay. Okay, another important segment is the ST segment. Now, ST segment again starts from the end of the S wave to the beginning of the T wave. So it will start, let me change the color of the pen, here. So from the end of the S wave to the beginning of the T wave, this one here is ST segment. You might have heard in MI ST segment elevation. So this is what we check in here. Now, what does ST segment actually denote? What do you have to understand about it? So ST segment denotes basically the end of depolarization of S denotes the end of depolarization of the ventricles, and T denotes the beginning of repolarization of the ventricles. So ST segment is the time between the two, and this is equal to 0.32 seconds. Please remember this. Okay, now another important interval is QT interval. Now, QT interval starts from the beginning of the Q wave until the end of the T wave. So this interval here, from the beginning of the Q wave until the end of the T wave here, this is QT interval. Now, why is QT interval important? Now, this is the total time taken by the ventricles to depolarize and repolarize. So this is ventricular, includes both ventricular depolarization and repolarization. That means complete activity of the ventricle is seen in QT interval. Now, the duration of the QT interval is 0.35 seconds to 0.43 seconds. Okay, now this was a little messy. I'll just help you revise everything here itself again. Now, when we talk about ECG, ECG is basically an electrocardiogram, that is the electrical activity of the heart, which is actually drawn on a graph. Now, ECG is recorded by a 12-lead system and is recorded on a millimeter square graph, which moves at a speed of 25 millimeter per second. Now, these graphs have square boxes of 1 millimeter. Now, 1 millimeter square box on the horizontal equals to around 0.04 seconds. And on the y-axis, this 1 millimeter box equals to 0.1 millivolt. This also means that on the x-axis we plot time, and on the y-axis we plot amplitude, or how powerful the electrical impulses are. Now, when we get an ECG graph, the graph looks something like this. So these are the waves that are represented in the graph. The first one is the P wave. The P wave tells us about the atrial activity or the atrial systole. So this one is atrial depolarization. After that, a PR segment is given in the graph. Now, a PR segment tells us the AV nodal delay. That means the time taken by the AV node to send the signals to the ventricles. So this one is PR segment. Now, if it is more delayed, that means there must be an AV nodal block, and that is why there is more delay. That we'll be seeing in the abnormal ECG lecture. Anyways, let's go back here. Now, the next one, when the signals reach the ventricles, then ventricles start to depolarize. That means ventricular systole start, and that is marked by QRS complex. So QRS complex marks the ventricular depolarization, and after that, ventricular repolarization starts. So the time between the ventricular depolarization and repolarization is marked by the ST segment. And finally, the T wave tells us the ventricular repolarization. So this, or ventricular diastole, that means when the blood is filling in the ventricles. Systole means when the blood is emptying from the ventricles or the atria. Okay, so this is what a normal ECG looks like, and this is what a normal ECG means. So if there is any changes in a normal ECG from the normal, then we call it a problem, of course. So this is all about an ECG. In the next video, I'm going to talk about the abnormal ECG readings. These may include supraventricular tachycardia and AV nodal delay, etc., etc. Thank you very much for watching my video. I hope to see you in the next one. Bye-bye.